and welcome to the ACR Bulletin Podcast, the show where we examine the latest trends affecting radiology. I'm your host, Chris Hobson, and today we'll be discussing a subject of growing interest to the specialty, environmental sustainability. Here to tell us about what radiology can do to help mitigate the climate crisis and contribute to environmental sustainability are two experts on the subject. Reed A. Omary, MD, MS, is the Carol D. and Henry P. Pendergrass Professor of Radiology and Radiological Sciences and Professor of Biomedical Engineering at Vanderbilt University. And Benjamin E. Northrup, MD, is Assistant Professor of Radiology at the Mallinckrodt Institute of Radiology at Washington University School of Medicine in St. Louis. Gentlemen, it's a real pleasure speaking with you today.
Thanks, Chris. Happy to be here.
It's
Absolutely.
great to be here, Chris. Thanks.
Thank you. Well, most people know that the Earth's climate is changing at a rate not seen in many millennia. The overwhelming scientific consensus attributes this change to human activities, which have produced a combination of gases, including carbon dioxide, methane, nitrous oxide, and water vapor that, when taken together, actually work to trap more of the sun's energy inside the Earth's atmosphere. This produces what's called the greenhouse effect, as most people know by now. And the medical industry has played a significant role in this issue we're now facing. So, Dr. Omary, I was hoping we could start with you today. Before we discuss the part that radiology specifically has played in the climate crisis, or in climate change, as some people prefer to call it, please give our listeners an idea of the current state of the climate crisis.
Sure thing. So the climate crisis is due to greenhouse gases, as you had mentioned. And let me be clear from the start, the cause of that is the burning of fossil fuels by humans since the industrial age. So roughly 3/4 of the emissions are due to the burning of fossil fuels. So when we think about the health of the planet, let's sort of think about fossil fuels as helping us grow from an industrial age, but also having an untoward effect on the overall health, not unlike smoking. And that temperature rise in 2015, the United Nations Paris Accords agreed that we, by 2030, would try to keep the rise between 1.5 and 2 degrees centigrade. This past year, 2023, it's in all the headlines, has been the hottest recorded year ever. Actually, it was measured at 1.48 degrees centigrade. Now, when we think about this, there's no magic number per se, but we know without a doubt that climate change is real and that the cause is due to the burning of fossil fuels and also agriculture. And so we need to work on that. We are almost certainly not going to hit the 1.5 degrees mark that we're aiming for, but it does mean that we have even greater urgency. The more that we can reduce emissions now, the greater impact it'll have later, not unlike compound interest.
That's a great way to frame it, like compound interest, something people can get their minds around, because some of this stuff can be a bit abstract and ephemeral. So thank you for providing that context, Dr. Omary. Now, Dr. Northrup, I was hoping you could please help us understand how medicine in general, and then maybe if we could zoom in a little bit to radiology in particular, have contributed to the problem.
Yeah, yes. Without question, those numbers are very disturbing. And unfortunately, the impact of the healthcare system is rather large, and there's growing evidence to support this. In the US alone, most studies suggest about 9.8 to 10% of greenhouse gas emissions are from the healthcare system. That's in America alone. Radiology's contribution within that also quite significant. A study from several years ago showed that a medium-sized hospital, this was in Switzerland, I believe, they had just three CT scanners and 4 MR scanners, and those alone used 4% of the energy at that entire hospital. And of course, those advanced imaging modalities, those are pretty big contributors to energy use. So over 1 year, one CT scanner will use about as much energy as five four-person households, and one MR scanner will use about as much energy as 25 to 26 four-person households. So pretty big contribution to that. Those numbers, by the way, come from a study that was in the Journal of the American College of Radiology, which is an excellent source for this. And I believe in February they have a sustainability dedicated issue coming out, correct?
I believe
Yeah.
that's true. Yes.
Yeah. So those previous numbers focus on energy use, but in addition to that, and that's probably our biggest contribution, but in addition to that, medical waste is also rampant in radiology. Sometimes the small day-to-day things are what adds up. Things like single-use contrast files. The contrast itself that we don't use is wasted, but it's also the containers, the plastic, the packaging, the paper. All of this adds up to a very large amount of waste. And then interventional radiology certainly produces quite a great waste burden on a case-by-case basis, averaging 8 kilograms of waste per case. So those are probably the two biggest things: energy use, number one; medical waste, number two, that we contribute.
Yeah, and I'm glad you put a fine point on that because reducing, as I'm sure will come more to the foray as we talk, inappropriate imaging is something that I know that you two have top of mind for reducing, and reduce, and thereby reducing the number of exams, and thereby reducing the amount of waste and helping sustainability. So I'm glad you're helping us start that through line. Thank you very much, Dr. Northrup. Now, Dr. Omary, I wanted to throw it back to you, and if we could talk for a minute about how the radiology industry has in recent years begun taking this issue more seriously. What is your position on whether and how radiologists should or could partner with industry to bring out these needed changes, to bring about these needed changes?
Well, that's a great question, and the answer is very simple. It's absolutely yes. And if we look at the United Nations, there are 17 sustainable development goals which were developed in 2015, and these are bucketed in terms of health. They're also bucketed in terms of social equality, eliminating poverty. And then we can also think about the third bucket as really being the planet, protecting the water and trying to mitigate climate change. The last of the 17 is to form partnerships. And when we take something as big and audacious as climate change, there is no way we can address it without partnerships. Government alone cannot solve this. And sometimes people will say, oh, it's really the role of government. Um, it doesn't take a lot of reading of the newspapers every day to realize the dysfunction in government right now, not just in the United States, but also across the globe. I would not really rest my children and future grandchildren's future on a highly functional government response to anything right now. And so when we think about partnerships, industry, nonprofits, government, all of them come into play, and we hear the term public-private partnerships. We need to have that in radiology. Uh, I was raised in my younger days with alternative music, and the concept there was that if you would sell out if you somehow were connected with a major label. But the truth is, um, we cannot remain isolated and achieve anything. And so industry needs to partner with radiologists and radiologists with industry. And then together we need to partner to try and help our government agencies recognize the significance and use some of the levers. For instance, what if CMS were to say that to all health systems, or this would come from the Joint Commission as a non-governmental entity, to say to be accredited, we need to measure our emissions. And so we need to do this. And I view partnerships as critical to success.
Well, you sort of jumped a little ahead, which is great. I was going to actually ask you a little bit about, some efforts I've read that are underway to establish a sustainability as a quality measure, and you just brought it up just in the perfect way. So I was hoping we could just stay on you for a minute and ask, like, can you help us understand this phenomenon and actually how it would work in practice in your conception of it?
Yeah. And so if we look back at the history of quality and safety, it was mostly under the surface until late 1999 when the Institute of Medicine published this groundbreaking work called To Err is Human.
Hmm.
And it was met with like wide open eyes and almost disbelief. What do you mean that 50 to 100,000 people might die each year due to medical errors? Uh, and because this had the gravitas of the Institute of Medicine, which now has changed its name to the National Academy of Medicine, a lot of health systems said, all right, we need to take this seriously. And they established safety and quality departments. And then it became actually required to be certified by the Joint Commission and other accrediting bodies. The same thing is going to happen with sustainability and emissions because it is a quality measure. How can we say that we as health systems want to serve our communities and our patients when we actually spew this pollution in the communities that are least able to stand it? And I can assure you that most physicians are not living next to the incinerators.
That's a good point.
Unfortunately, unfortunately, many of the patients are, and they're the ones who can least advocate for the change. So it is incumbent upon us in healthcare and particularly in radiology, given our central role in the health system, to advocate for change. Our patients deserve it.
That's so interesting. And I know I'll be keeping my eye on any kind of alternative payment models that allow those sorts of and encourage those sorts of quality measures. So hopefully that will come to pass and we'll have you all back on to talk about the update. So thank you so much, Dr. Omary, for going into some depth on that. Dr. Northrup, I was wondering, now that we have a better handle on what the crisis is and radiology's role in it, I was wondering, in your own practice or maybe in your own thinking about the subject, how can and again I alluded to the fact that it is growing in importance and popularity within medicine, but how as radiologists do you think you can drive that message forward and really convey the importance of environmental sustainability within radiology or even within your own practice?
Yeah, yeah, Chris. Luckily, there's mandates out there from large organizations, including the World Health Organization, and they have a recent quote that I think is very powerful. So they call this the single biggest health threat facing humanity, and they call upon all of us to avert the impending health catastrophe by limiting global warming to 1.5 degrees Celsius, as Dr. Omari previously mentioned, by 2030, and to make human health and equity central to all climate change mitigation and adaptation actions. That's a quote from them. So, in light of this, certainly we're all called to action. But why specifically radiology? Why are we important in this? And there's a few things there. So, first, we're one of the largest contributors in the healthcare sector. So, simply by virtue of that, it's not only our duty, possibly more so than other specialties, but also we have the ability through even small changes, small things we can do in purchasing, workflow, behavior. These little things can make a huge impact. And hopefully, if we get to big things, we could really make an impact. The other reason it's important to radiologists, and even if you're someone that maybe isn't interested in those things and you just want to keep practicing, well, the future of our specialty really depends on it. We use a number of non-renewable resources: iodine, gadolinium, helium, several of the radioisotopes, and that's just to name a few. So limiting the use of these, recycling when possible, that will help ensure the future existence of our specialty. So really, no matter your views on this, there's something for everyone. We can all come together and see that this is something that we need to worry about. Yeah. And then finally, you mentioned the reimbursement portion of it too. Some of these sustainability measures, most of them, I would argue, have the potential to save radiologists millions of dollars. And this is huge right now, right? Every year we're talking about the MPFS cuts, the Medicare contractors, the third-party payers. Coverage is always getting more limited. There's always looming financial issues, looming economic issues, and the potential to save our departments a huge pile of money with this is very helpful.
Well, it's very interesting. You all have touched a few times now on the fact that there's nobody's in isolation on this one. Like we're all kind of in this together. And Dr. Northrup, I think everything you were talking about there kind of underlines that fact. So, Dr. Omary, I was wondering, in light of that kind of aspect of the approach to mitigating the crisis, how can medical students, in your mind, and other medical professional students, such as PAs and NPs, actually help with environmental sustainability?
Uh, we have a great opportunity through our younger generation, and this always is a recurring cycle of history. It is younger generations that lead us into the future. As we find more medical students, more nursing students, more physical assistant students entering the workforce, there is a desire to implement actions that will benefit the climate. But I think we are best served by flipping the narrative, Chris. And right now, we think 2024. If you're graduating from college, and there's no college, even in the United States, that doesn't have a majority student body that considers climate change the number one or number two issue. I mean, it does not exist. Okay. So when you're graduating from college, you're thinking about careers. And if you're interested in climate, you might go, oh, I want to go to law school and be an environmental lawyer. You might say, I want to, I'm in engineering, I want to do environmental engineering. Or, even if you say I want to go into finance and I want to think about new policies that will be climate forward. In 2024, you don't go click on the jobs board and say, I want to go into healthcare because I care about climate. It's nonsensical. That is the greatest single opportunity we have to bring more people into healthcare. We actually are closing the gates on the younger generation wanting to enter healthcare, because healthcare has found itself really in this transactional moment of let's increase volumes. So much so that we find two-thirds of nurses are burnt out. One quarter of practicing physicians are clinically depressed. One third of senior residents would actually not enter medicine again. So we have not just a crisis in sustainability from an environment standpoint, we have a crisis in sustainability in terms of a future healthcare workforce. So this is our opportunity to flip the script and say, what can the younger generation bring to us? Open our eyes to a future where healthcare is a sought after profession because it interacts both with human health and the health of the planet.
That's a really powerful message, and I hope we can continue kind of beating that drum, because I think you're right. It's almost counterintuitive to some people about how healthcare kind of is so enmeshed with the climate change and climate crisis. So thank you for spelling that out. Now, I know, speaking of academia, I know Dr. Omary, you're in academia, and so Dr. Northrup, now you are also as well, and you have been for the last 7 years. But I know, Dr. Northrup, before coming into academia, you were in private practice. So I'm wondering, just given the mix of experience we have here and expertise, I'm wondering, you know, I guess maybe somebody who's listening to this episode right now and doesn't know where to get started. Maybe if we can kind of think practically, how would somebody go about integrating environmental sustainability into their practice, both from a, maybe they're an academic kind of area, or maybe from a private practice standpoint. So, Dr. Northrup, what do you think, or maybe just a first step somebody could take for in those two kind of areas?
Yeah, so certainly as a first step, first off, there's just a number of resources out there to get you started if you need ideas, and that's really been my early mantra on this. I've always been more of a lead by following type of person. There's so many great ideas out there, between Dr. Omary and the leaders that we have in the ACR, the leaders that we have in Radiologists for a Sustainable Future, the AUR, RSNA. There's a number of organizations with great ideas, but other than reading those, I would start with small things, particularly, especially in private practice, things that are not particularly obtrusive to workflow, things that everybody agrees can be helpful for themselves, for the hospital system, for the patients, things that are kind of easy, things like that. One example of that we've done here is the GE contrast recycling program. 100% free. They send you the containers, they send them for free, you send them back for free, you fill them up with unused contrast and avoid just throwing that out. So that's a small, easy thing that anyone can do that's completely free of cost and doesn't really change workflow that much. Because, of course, when you're done with the contrast, someone has to get rid of it, right? It's either trash or the container. So yeah, it's a nice, easy thing that you can. So that's one idea. But yeah, certainly looking at all the ideas others have had through all of our great organizations that have set these up and put resources out there, both on the web and on Twitter. So, and yes, and then getting back into the academic side of things also. So I agree with Dr. Omary. I mean, the younger generation, there's so much energy, both undergraduate students and medical students. At our institution, when we send out emails of possible research projects, advocacy, small local projects, the response is really overwhelming. It's incredible. I mean, the energy and the passion for sustainability in this younger generation is really, it gives me a lot of hope going forward. In terms of residents and fellows that I interact with more commonly on a day-to-day basis, a lot of it is modeling the behavioral changes that you need to have a sustainable radiology practice. First off, protocoling studies, I think, is a big thing. And I know we're all busy and we don't want to go through and approve and quote, block studies, but it's important to evaluate everything that comes to you, especially, well, advanced imaging, and making sure that it is necessary. And that goes back to what we mentioned before with that Radiology Teaches model. That's one of the focuses there. So you can look at some background there as far as best practices in terms of appropriate imaging and sticking to the ACR appropriateness criteria. But if you protocol each study, make sure it's really necessary, we can really take our role of what a radiologist should be, which is an imaging consultant, not just someone that the study comes through, you read it, go on to the next one. We should be the consultants that say, okay, is this necessary? Should we do it? How should it be done? And then we read the study. So that's an important thing to model, I think, to residents and fellows. Other things, other day-to-day habits that can be helpful. After a procedure, we do lots of spine procedures. So I always make sure I mention any unused contrast we need to recycle. If we have a choice of different vial sizes, we definitely want to get right-sized contrast vials. So if we know we're only going to use 10 mils or something for a nerve root injection, then we can just use that vial. And although you'll still have the same packaging and plastic waste, you'll waste a little less contrast. And those are smaller vials, so maybe slightly less packaging waste, because you'll end up throwing it all out if you use the 50 mil, right? So either way, you'll save a little bit. And then a lot of smaller teachable moments too, like turning off the workstations if you can, turning off the lights in the room when you leave. A lot of those day-to-day habits, I think, are probably the best things to focus on too, just when you're teaching residents and fellows day-to-day in the reading room.
Well, thank you for all those really practical suggestions. I think that's got a lot. It's going to give people a lot to chew on, and you mentioned a couple of those resources as well a little bit earlier. We'll link to some resources in the show notes for the show. And something else I was struck by, especially when it came to the medical students, you were talking about both undergraduate students and medical students, is I love that message that almost like global or like climate change is local because intrinsically when we think of climate change, at least my mind goes right to the whole planet, and that can be a little overwhelming for people like how am I going to change the whole planet. I love what your answer because it felt like you were really suggesting people start locally or on the city level, like with some of the projects that they mentioned. So thank you, that's all great takeaways for the audience. And I got Dr. Omary, same question to you. I mean, what would you suggest maybe a first step or two would be for maybe somebody listening today who doesn't know where to start?
Well, I'd really like to echo and amplify what Dr. Northrup said. So when we think about sustainable healthcare, it's really important to try and glom sustainability into other priorities that are already present. And when we think about the care that we deliver right now, we have a shortage of radiologists. Uh, every radiologist is overworked. The lists never get small. That's one of the truisms, and I've heard it described as being like the post office. It just keeps coming, or
Um,
it's like in the I Love Lucy with the chocolate factory.
right.
So the most sustainable healthcare is actually the healthcare. It's avoiding the healthcare that we don't need to deliver. So so if we don't need to do a given exam, that's a win for the patient. Who wants to get scanned if you don't need it? It's a win for the overcrowded hospitals, or certainly the emergency rooms in those hospitals. It's also a win for all the staff that is already overworked. But you know what? It's a win for the planet. And so when we think about this, these are on every from every single uh, lens, a real positive outcome is thinking. Then going back to this, going back 10 years ago to this concept of clinical decision support. Is the study necessary? Well, who would have thought that clinical decision support fundamentally is a sibling to sustainable healthcare?
Mm.
And so when we can bring this together, and we also had heard a little bit earlier from Dr. Northrup in terms of equity. Who would have thought that equity and addressing climate change are actually they're two sides of the same coin. You cannot we cannot have a strategy that addresses health equity, a comprehensive strategy that does not also address reducing emissions. So, anyone that's listening that's in the equity world, if you're not thinking about climate change, you have a blinder on. You have to think about climate change because we know that that's the greatest social determinant of health. And the flip side is also true. If you're in the climate world and you don't think about equity, it's time to start thinking about how our climate actions will benefit the communities that have been disproportionately um, uh, affected by climate change. And so we have this capacity to view equity and climate change uh, mitigation as a flywheel. And
Mm.
the more people we can bring in to address this, the better off we will be.
That's such a great place to end it on. It's well as the team aspect of it, which I think has been a through line through this whole episode. Thank you so much, gentlemen. It's really been a pleasure speaking with both of you today. Where can people find you online if they want to talk about this really vital conversation? Dr. Omri, starting with you.
Well, I'm on Twitter, which is now known as X, is at Read Omary, but I'm also on LinkedIn, and uh, I'd really, for those aren't on LinkedIn, it's actually a quite a professional platform with some less of the issues that might be present with other platforms.
Excellent. And Dr. Northrup, where can people find you?
Yes, yes, agree with LinkedIn. I'm on that as well. And then on Twitter or X, I'm at Ben Northrup MD, all one word.
Excellent. Well, thank you so much. And I'll add that if any of our listeners have any ideas for future show topics, please let us know on Twitter or X at Radiology ACR and use the hashtag ACR Bulletin Podcast. And I also invite you to check out all of our past episodes at Apple Podcasts, Spotify, Google Podcasts. And please be sure to subscribe to ACR's YouTube channel to see our latest episodes. And please do hit that like button if you found today's episode valuable. Thank you, gentlemen. Again, we hope to have you back in the very near future to discuss this very important topic.
Thank you.
Thank you, Chris.
Thank you very much. And thanks to our listeners. This has been the ACR Bulletin Podcast. See you next time.